Welcome to the presentation with the topic FEA of SI screw fixation of contralateral subsequent fractures at the posterior pelvic ring. The surgeons of our department have frequently observed that contralateral subsequent fractures are reduced with the bilateral screw fixation of the posterior pelvic ring compared to unilateral screw fixations. But there is no justification for it. Based on this knowledge, the aim was a comparison of the stress in the pelvic ring between both fixation techniques with an FER. The assumption is that the bilateral screw fixation leads to less stress on the contralateral side. In order to investigate this, a full pelvic ring model was created and a fracture at the sacrum and both papillogram was applied on the same side of the model. The bone was simulated with isotrope linear elastic material with an individual module for each element. All ligaments are simulated as only tension springs with a changing stiffness depending on the elongation. The SI joint and symphysis are simulated as discs. The whole model was fixated on the top of the sacrum. The maximum load of the walking cycle was applied separately on each side, and in a third simulation the half of the maximum load was applied on both sides. The normal stress was analyzed in all three dimensions. There wasn't a big difference except for the lateral medial direction. The analysis in each configuration pointed out that a bilateral fixation reduces stress. When the load is applied on the fracture side, nearly the same stress curve emerged. The biggest and important difference is seen in the contralateral side when the load is also applied on this side. In the two-leg stand, there is also less stress with the bilateral fixation. The movement of the fracture gap is always minimized with the bilateral fixation. It follows from the result that the bilateral fixation decreased the tension of the contralateral side. The movement of the fracture gap is lower and more beneficial for fracture healing. This means that for the clinical use, a bilateral fixation is an option to reduce subsequent fracture. Thank you very much for your time and your attention.